Okay, so on post-op day number 5, I can show you more walking, but it doesn't really look too much different, even though I can tell you that a little bit looser, my legs a little bit stronger. Actually, I was able to put as much as full body weight if I just want to stand. But I can probably get up to probably 90% of weight bearing on the leg, compared to, it's improving every day. Let's just put it that way. Still am unable to pull my leg into midline when it's out, so that's the adduction. I really don't have any adduction strength. My abduction, pulling it out, it's limited. My range of motion, it's interesting when I'm standing up and bringing it out wide. It's as wide as it used to be before the surgery, but I know that's because of weakness and stiffness. Before, it was because that was the full range. You couldn't pull it if you yanked it. I usually is sitting at least 90 degrees to 100 degrees. I still can't get up to 120 degrees. Worked out a lot. Actually, I walked for an hour and 15 minutes straight. I have long hallways in the house, so I'm not going outside as of yet. But I walked non-stop talking to my daughter, who was daddy sitting me today. But for an hour and 15 minutes non-stop, figuring that someone usually walks 3 miles an hour, if even 2 miles an hour, I walked over 2 miles non-stop. And after that, ice down again. I'm taking probably 1 Percocet a day. I'm taking the Tramadol 4 times a day, just 1 pill. I find that it's actually helpful to take the Percocet. The stiffness and a mild aches, is at most. So at most, when I'm really tired and I've done a lot of work, I'll put it at a 1 or 2, which is usually less than anything. I never have a sharp pain. Just being careful, because, as I said, one of the scariest things is I feel so good not to overdo anything that I'm not supposed to do. So I'm sticking to the protocol, mainly lifting, using a lot of ankle pumps and quad pumps and gluteal pumps, and trying to lift my foot up. My hip flexors are still weak, but I do notice my foot's straight. It never was before. As far as anything else goes, feeling pretty good. I mean, 5 days post-op. My goal was to walk 1 mile at the end of 1 week, so I've obviously surpassed that. So I'm not looking to set any goals or any records. I'm just taking it as it comes, so I'm just happy the way things are. The wound's not infected, and wearing the compression, as I said, the white compression stockings that are good for DVT, I find better. They go up to the thigh. They're graded compression, as opposed to there's 2 types of compression leggings. One that's just for generalized leg swelling, and that's not a graded compression. So the graded compression I find is better. It's more comfortable. I can actually say that the worst part of this entire procedure, or pain-wise, had developed some skin abrasions from the wrap, and not dealing with that before, they became skin abrasions. Not any big deal. Just treated with a little sulfidine and just wrap, and that's fine. And everything it takes a long time, but it's great. So things good at day number 5.